Relocating to a new country and starting training or working in a new healthcare setup can be extremely daunting. There are challenges related to training, familiarizing yourself with a new work setup, new colleagues, cultural differences, and often being away from family during what can be a stressful journey. It's important to acknowledge how important it is to have the right support during that early transition to a new place, but also throughout the process and beyond. In this podcast, we discuss the importance of supporting medical trainees and doctors from abroad who come to the UK to pursue and progress in their career. With international medical graduates, or IMGs, comprising up to 40% of the GP workforce in the UK, it's essential to ensure adequate support is available. To discuss this today, I'm really pleased to be joined by Dr. Azza Elghonaimy, who will not only be sharing her own journey of progressing in her career as an international medical graduate, but as a nationally elected RCGP council member and Yorkshire faculty IMG Rep, discuss the role of the college in supporting international medical graduates and share her experience of what sort of support is needed and helpful, and what more can be done to help new doctors and trainees coming to work in the UK. Azza, thank you very much for joining us today for the InnovAiT podcast. It's a pleasure to have you on the podcast to discuss a topic that I know is very close to your heart, and you have been working towards supporting IMGs in various ways through your varied roles with the college. Azza, I understand you yourself relocated from Egypt, where you obtained your medical degree. How was that journey for you for moving to the UK, acquainting yourself with a different healthcare setup and culture?
Hi, Sadiya. Thank you very much for having me. It's a pleasure for me too. When I relocated from Egypt, it felt like starting a new life altogether. There were a number of cultural and societal changes that required to adapt to. It wasn't an easy journey, I must admit. I felt I needed to explore NHS system further, to see the difference from Egypt's system, as well as the communication with the British individuals in order to learn the culture. That was really important too. So I did several clinical attachments in the local hospital. And in 2006, I began working in a non-training and then training posts within the NHS before starting my journey in GP training in 2011 as a less than full-time trainee at the Pennine VTS scheme in Yorkshire Deanery, and I obtained my CCT in 2017.
What would you say, Azza, were the greatest challenges that you had to face in that journey, and how did you overcome them?
Thanks, Sadiya. So the greatest challenges were juggling between being a mother of two. My husband was studying his PhD and also pursuing my career and getting through exams. It was tough, as we don't have extended family here in the UK. We overcome it by being more organised, having a plan well in advance. Financially, we had support from families back home, from our families, as well as the small community here. When I arrived to the UK, it was in 1999. Unfortunately, that were not too many medics at the time. But the minorities that we had, or the very few members of my community at the time, they were sufficient for me at the time to guide me through, at least to be there for me and for us to go, well, as families as well, as small families, young families thriving in the UK. I'm pleased that the IMG community has grown so much throughout the years.
Mm-hmm. Absolutely. And how would you say, Azza, that the college supported you as an international medical graduate during that time, during your training, and also afterwards, as you've gone on to do some amazing things? And what was the process of getting that support for you at that time?
Thanks, Sadiya. So, in the past, we have been offered Life in the UK courses plus sessions. This is when we arrived to the UK. But I am very grateful to our vocational training scheme for their understanding as being the IMGs and giving also as an opportunity to be able to train as a less than full-time trainee. The college provides various resources and courses to assess trainees and first fives at their early career stages. I am very I'm very glad to see that the number of the resources and that it's available in the website, which I would recommend strongly. There are various free and subsidized courses, modules currently. We didn't have as prior to start the GP training, there were less support for IMGs.
No, absolutely. As we were discussing before this podcast, and you were telling me how limited both the resources were and how few a number of international medical graduates there were at the time when you came to the UK, and how much now support resources are available, but how many more international medical graduates we have now in the UK who are working and progressing in various aspects of general practice and other health professions as well. Which is wonderful to see. You've very helpfully mentioned about some of the support that's available through the college, and we'll touch a bit more on that a bit later on in the podcast. How would you say GPs within the practice can support their international medical graduate colleagues, whether they be trainees or doctors who have trained from abroad and now working in the UK? What sort of things should colleagues be considering?
So I think the trainer is the right person to advise. As we are different individuals. In addition to, just for clarification, the terms international medical graduate can be a title for a British graduate or a British GP or a doctor who had been he obtained his primary medical qualification abroad. So the needs would be different too. Also, some IMG trainees have done NHS work prior to start of their training, of GP training, like myself. So we are different, and it's very difficult to answer this question. Once the IMGs are qualified, then he or she will be treated the same as everyone else. Unless there is any sort of neurodiversity or disability that needs addressing. Otherwise, I don't think qualified IMG GPs needs to be treated differently. I'm aware that some have relatives in the war zones, for example, which I am sure their team will be considerate.
I think you've very much reiterated there that having, I think, consideration of offering support where it's needed, being aware that every colleague of ours will have different needs, whether they have worked or trained abroad, coming back to the UK, and some of the things that you mentioned right at the beginning of the podcast about the various other aspects, financial aspects, maybe not having as much extended family support. So taking that into consideration during training and beyond is really important and to take into account.
Absolutely.
So tell us a bit more about the IMG group on the RCGP Members Forum, which is something that, again, I think would be a very useful resource for GPs to also have access to know what sort of help support is available for colleagues. What sort of things does it address, and how can it help?
Certainly. So it's a forum that has been created by the college, and it is led by myself as well as my colleague, Dr. Emma Odumwani. He's a nationally elected council member and vice chair of the North West England faculty. So the forum serves as a platform to discuss relevant issues, address specific queries, share learning points and experiences, offer tips on supporting IMG colleagues, even announcing events across the UK, and facilitate private messages and discussions, Sadiya. Really I would encourage everyone to actually use the forum.
There's some really good resources, lots of useful information on there, so definitely I absolutely agree. Azza, tell us a bit more about the Northern Faculty's IMG steering group, of which you've also been the chair from I think November 2022 to October 23. What is its purpose and why was there a need for it to be established?
So in June 2022, the group was established by members of the Yorkshire, South Yorkshire, North Trent, North West England and Humber Riding faculties. We are 7 faculties in the north. The Northern faculties includes 7 faculties. So we thought the objectives when we started the group were bringing our regional IMG community together, which we thought is really, really important. We felt it. Providing an opportunity to be mutually supportive and provide for people's needs as well, for the needs, supporting for individual needs, really, what they would prefer to how can we help each other as a peer support as well. Use meetings to help spread best practice, hopefully change catalysts to improve the experience of IMGs, exploring how we can share the discussions with the wider community, sharing concerns, growing the IMG voice, which is really important. We, so far, organised various successful events, both virtual and in person, to enhance the IMG networking. We hosted the informative webinars that including stakeholders like HEE, NHS England, GMC, MTU, Wesleyans, and as well as social events to provide the support for the well-being of the IMGs.
Apart from this, are there other resources as well that trainees, First Fives can find out about, other events for IMGs that the college offers? Where can more information be sought on these?
So I think if they can try the forum first, and then if they can't find any useful events for them, they can try the college website and on the drop-down list of the events and courses, and I'm sure they will find what they would look for.
That's great, Azza. Thank you. And what would you say has been the feedback from such events in your experience from IMG trainees?
They found the events extremely useful. Some of them are recorded, so they can replay them and use resources and tips that have been shared throughout the training and beyond, which is really pleasing.
The thing that I wanted to discuss in our podcast, as there was the process of finding work or getting a visa, which understandably can be very stressful for many IMGs, and they're anxious about possibly even having to leave the country. In fact, some IMG trainees, as we know, consider not working as an NHS GP because of difficulties with the visa process. How has the college supported these trainees through the visa application process and with finding work?
So the college has been in communication with the Home Office, Sadiya, and recently the Home Office introduced the 4-month extension on completion of training to give them more time to find appropriate sponsorship. Our Vice Chair, Dr. Victoria Brown, said in March 2024 that it's more important than ever that a wider solution is found to allow recently qualified GPs to obtain long-term visas to remain working in the UK, as set out in our general election manifesto, which is the 7 steps to save general practice and safeguard our NHS. We are calling for the Home Office to revise current rules to allow GPs the right to apply for the indefinite leave to remain after 3 years in the UK or a 5-year visa at the start of their training. So the college is working hard to help and support the IMGs and to help as well the membership retention.
Azza, where else can IMG trainees go for further information and support if they need in regards to this process?
I would still recommend to search the college website, and especially the Overseas Doctors Guide page. Also, they can look at the LMCs, NHS England, GMC, HE, and equivalent in the 4 devolved nations. I'm sure they would find some further information in their websites, and they can ask their own training programs as well as their training program directors and the VTS.
So what else would you say can be done to help support international medical graduates to ensure that their transition to training and working in the UK healthcare system goes as smooth as possible? We've discussed some of the resources that are available. We've discussed some of the potential issues that might arise. Where else would be the points of contact?
For ongoing support for the trainee, I would encourage as well to again get the support from their own faculties, from deaneries, from the VTS, the TBDs. The peer support is really important. Looking for mentoring as well, and more important is the enhanced induction program, because it can lead to early identification of any gaps that they need to be addressed at the start of the training. Beside this as well, I would encourage for the neurodiversity, if they feel they are dyslexic, they would need to have this screening right at the start of the training, and that will help as well a smooth training. As well as the others, which I'm sure their VTS scheme would be able to cover with regards to consultation skills and portfolio. And the portfolio itself, it's an art on its own, and the art of reflection, which it actually it doesn't exist in other countries and other systems, I'm afraid. Maintaining their well-being, that's important as well. And finding their tribe, finding their own community that they feel comfortable to share their experience with and take some guidance. And post CCT or after qualification, I would again recommend to engage with the local faculty if they are happy to do so. Why don't they be the first 5 for the faculty? Why don't they be the IMG representative in their own faculties, and looking for, and also just looking around in GP and in our college jobs website to any job vacancies. There are different types of, they can be a portfolio GP, so they're not strict to just a salaried or a locum or a partner, but they can diversify their career, doing different jobs during the week, which will help them to thrive and maintain their well-being and have a well-balanced work and life as well. Volunteering roles is important. Why don't they be seeking mentoring? And we've got a fantastic mentoring scheme in the college. And once they reach the 5 years of training, they can apply for the fellowship and being a fellowship of the college. And I believe there are some fellowship schemes as well after CCT, but that is run by different organisations.
That's really helpful. Thanks, Azza. Finally, as a passionate IMG advocate and thinking back to your experiences through this journey, what else would you like to see being offered to IMG and First Fives embarking on a GP training pathway?
So, looking ahead, I'm just going to speak on behalf of myself and my colleague Owa. We are quite passionate to try to collaborate further with the organisations, other organisations such as the HEE, the NHS England, the GMC, the BMA, the BEMA, and others to provide a unified support for IMGs in order for them to thrive in the UK. We still hear from some IMGs that the enhanced induction, for example, it's not as sufficient as it should be. And in some areas of the country, I don't have statistics. I wouldn't be able to say so, but it's really important for them to thrive is to get the actual or the proper enhanced induction at the start of the training and throughout the training and beyond.
Yeah, no, that's really important, and thank you for highlighting that, Azza. You were doing some amazing work through the college to support IMGs in various ways, and through the Northern Faculty Steering Group particularly, which I know has had some really wonderful feedback from IMG trainees. We always like to end the podcast with your top tips, and what would you say they would be, Azza, for IMG trainees? What are the few things, maybe 2 or 3, that you would like to put to them that might help support them, that you think would be helpful and relevant?
So, my first top tips top tip is to ask. You just ask, be confident in yourself. Ask if you feel like you're not quite sure of any information. When you ask at the start, it makes life easy for you throughout your training. And look after yourself, maintain your well-being. It can be a daunting journey at the start. Look for support, peer support. Maintain your relationship with your family or friends or anyone you feel like you're feeling comfortable with, to be able to have your own life beyond your training and being at work. And the rest, I think we have mentioned earlier. And best of luck for everyone. Be caring for yourself. That would be my final word. Thank you.
Thank you so much. It's been an absolute pleasure to have you today talk to us and discuss so many helpful, relevant things. And I'm sure our listeners will agree with me on that.
Thanks, Sadiya. Thank you so much.